Hello, hello, sir. Hello, ma'am.
Hello.
Okay. So shall we start the session, sir?
Yes, yes, fine.
Okay. So good evening, everyone. We are back with our live session at Healer's Corner, and today we have with us our guest speaker, Dr. Priyanka Supare. She is a student at Antarbharti Homeopathic Medical College, Nagpur, and Dr. Kamlesh Kakde, sir, who has been practicing homeopathy in Nagpur for more than 15 years now. So, our today's topic is Guillain-Barré Syndrome, and from symptom to solutions. So, without further ado, we'll start the session. Over to you, Dr. Priyanka.
Good morning, sir. Good morning, ma'am. Myself, Priyanka Suparim. I'm a first year BHM student. And first of all, I like to express my sincere gratitude towards Dr. Kamlesh sir and Dr. Vinaya ma'am for giving me opportunity, as these opportunities are rare for students like us.
Welcome,
So,
Dr.
sir,
Priyanka,
can
and
we?
we are so happy to have you here today.
Yes. So, sir, can we start the session without any further delay?
Yes, yes, sure.
Sir, nowadays the disease GBS, Guillain-Barré Syndrome, is being talked more frequently, and like the occurrence is also very frequently. So can you tell me detail about what is Guillain-Barré Syndrome,
Yes,
how it affects the body?
sure, sure. So, as we all know from news, that nowadays Guillain-Barré syndrome is spreading like anything, especially in and around the areas of Pune. And now some cases has been also reported in Nagpur. So basically, what is GBS? GBS is a neurological condition. Basically, it is autoimmune disease. So our own immunity uh, fights against our own cells, and that's why, especially the nerve cells, and that's why these nerves get damaged, which in turn causes symptoms like weakness, numbness, and also paralysis in some cases. And this paralysis or these symptoms often starts in lower parts of the body, and then it ascends upward. It spreads upward. And sometimes in severe cases, there may be some respiratory symptoms also. Means respiratory muscles, they get affected, and it causes difficulty in breathing, increase heart rate, and sometimes it shoots up blood pressure of the patient, and it can be life threatening in severe cases. Should I talk more
Okay,
about GBS?
sir. Yes, sir. So, like, sir, how is it? How does it affects the body?
So it
Like,
causes
what?
weakness, numbness,
Yes.
paralysis. Like these are the symptoms of GBS, and this paralysis or these all of these symptoms are ascending in nature. Means it start in lower part of the body and then spread upward, and then patient
Okay.
gradually becomes bedridden. Patient cannot move. This is how GBS
Okay.
affects that person.
So, is there types of GBS?
No, in my understanding, there are no types of GBS. GBS is
Okay.
autoimmune disease, and it affects nerves, especially the myelin sheath. Myelin sheath is a covering of nerve, and it damages that myelin sheath, and it causes inflammatory processes, and that's why all these symptoms develop.
Okay. So, sir, what are its like signs? Like, what are causes and its signs and symptoms? Mainly, which people see.
Yes. So generally talking about causes, so if patient has any viral or bacterial infection, it may trigger autoimmune response because it is autoimmune disease, right? Our own immunity fights against our own cells. So it needs some trigger to start this autoimmune response. And this uh, trigger may be any viral or bacterial infection like Campylobacter, COVID, like these viruses or
Yes.
bacteria. Sometimes surgery or vaccinations may also trigger autoimmunity in some people, or there may be some autoimmune triggers, reactions, uh, which in turn causes GBS. And talking about sign and symptoms, so as I said earlier, there may be neurological symptoms. There will be neurological symptoms, and it will express in the form of tingling and numbness of muscle, weakness of muscle. So this patient has profound weakness, especially in lower part of the body. And then this weakness spreads upward. So first they started to feel weak feet or weak leg. Then it spreads upward to lumbar area, then back, and then whole body gets paralyzed. So this is how gradually symptoms develop. And because of this weakness, because of this paralysis, patient has difficulty in walking and doing routine work, daily work. Patient becomes bedridden, and there may be pain, especially at lower back. And in severe cases, there are these respiratory symptoms like difficulty in breathing, palpitation, increased heart rate, or high blood pressure. We may observe these symptoms.
Like conventional treatment like plasma exchange and immunologin therapy is done. Like how homeopathy complementary is like complementary case, like how does it balance immune system?
So, as I told that this is autoimmune disorder, and we know that any disease develops through PNEI axis, right? Psycho, neuro, endocrino, immunological axis. So when psychology gets disturbed, it disturbs neurology, it disturbs endocrinology, and it disturbs our immunity. So when this immunity turns against ourselves, it turns against neurological system, right? So these two parts of this PNA axis already affected, and how it started from disturbance of psychology. So this is the whole spectrum of development of any disease, especially GBS. So we need to treat this whole axis, the PNEA axis, to cure any disease, especially conditions like GBS. What we do in homeopathy, we study person as a whole, patient as a whole, and we prescribe on the basis of this disturbance of PNEA axis. And what homeopathic medicines do, that homeopathic medicine try to recorrect this disturbed PNEA axis. And when this PNEA axis got corrected, then it cures that particular disease. So best way to treat any disease, especially GBS, is through homeopathy. Only holistic care can relieve or cure this disease very promptly, effectively. So we need to understand this disease process. We need to understand that particular person. And after doing that, when we prescribe homeopathic medicine, this will help a lot. GBS may be life-threatening situation. So we may need life support sometimes. We may need oxygen, we may need hospitalization, but along with that, if we take holistic homeopathy medicine, then patient will come out of this severe condition like miraculously. I had one patient of GBS before 8 9 months, and he had hospitalization. He received all type of plasma exchange and immunoglobulin therapy and everything. And after doing everything, then doctor discharged that patient, and patient was still paralyzed. He could not move limbs and any part of body. He was weak and he could not move. And relatives were really worried what to do now because we have tried everything. And doctor discharged this patient. Now they are saying that you just continue this treatment, and we don't know when this patient is going to recover. Is this patient going to walk on his leg anymore or not? So we are not sure about that. And at this point of time, we prescribed him homeopathic medicine, and miraculously within 24 hours, patient started to feel sensations in his limbs, and within 48 hours he could walk. So this is this is how effective homeopathy is. This is my personal experience with GBS, and how why this is possible. We tried everything. Now we tried plasma therapy, we tried immunoglobulins, we tried everything. But see what plasma exchange do, that plasma removes harmful antibodies from the blood, right? What immunoglobulin therapy do, that it provides some healthy antibodies to block the immune attack. But these are local arrangements, right? We need to recreate this tendency of immune system, that it should not attack our own cells. And only holistic homeopathic treatment can do this. When we try to understand this PNA axis, and when we address specific issue, specific problems, specific disturbance of this disturbed PNA axis, then only this is possible. So after all, every doctor wants to save life of his patient, right? So rather than fighting between systems, we should try everything to save these patients, especially in conditions like epidemics of GBS. In such conditions, so we must try homeopathy also along with conventional modern treatment, and patient can get cured very promptly. So there is no harm in trying homeopathic treatment. It will do good to for that patient who is already in suffering.
So, can actually homeopathy helps in recovery of the nerve damages, like which caused by the GBS? Is it permanent or does it reoccur, the
In
nerve
some
damages?
in some cases it is permanent, because before 2 3 days I have seen one patient who has GBS before 18 years, and he is still paralyzed. He cannot walk properly. So GBS causes permanent damage to his nerves. So what is good idea is to start treatment as soon as possible, as early as possible. If you start treatment, then chances of recovery are much higher. So as soon as you have some symptoms, tingling, numbness, weakness of muscles, consult your doctor and get diagnosed, start treatment as soon as possible, and chances of recovery is much higher, and patients can completely recover from this disease without any traces of symptoms.
Okay, so how long does it take for the recovery?
So we can divide these cases into two types of cases. One is cases with very mild symptoms. So these cases can recover within 1 month or 1.5 months. Some cases are long-lasting effects on nerve damage and this paralysis symptoms. So this may take long time to recover. Even I just told you that this patient has GBS symptoms and paralysis since last 18 years, and I don't know whether he can be recovered at this point of time because it because the injury and uh, damage is almost become permanent. So early the treatment, better the prognosis. This is the key to treat GBS.
Uh, Sir, does it like there are symptoms like gastritis also, but how it like connected through the GBS because GBS is a nerve damage. So how this connected with gastritis symptoms?
See, there how all the systems work is through nervous systems, right? There is mesh
Yes.
network of nervous system, sympathetic, parasympathetic nervous system, and each and every organ is supplied with nerves. Even digestive system is also supplied with nerves, and all these nerves get damaged, which causes irritation, which causes imbalance in their function, and in turns it causes disturbance of digestive system. That's how a lot of symptoms develop because there is paralysis. So sometimes there is paralysis of GI tract also. It may cause imbalance of GI tract. So that's how all the symptoms of GBS develops. But idea is not to treat each and every organ individually, but we have to look for the whole person. We need to treat the whole, not the part of the person. This is the idea, right?
Yes. So can you give us like examples of homeopathic medicines you can give in nerve damage?
Yes. So basically, um, in homeopathy, we have two principles. First is the holism, and second is individualization, right? What do we mean by
Yes.
holism? Holism means we consider person as a whole. And what do we mean by individualization? Means we need to understand this whole person, how individual he is than other people, right? And on the basis of that individuality, we prescribe medicine. So we do not prescribe medicine for nerve. We do not
Yes.
prescribe medicine for nerve damage, but we prescribe medicine for that person who has that nerve damage. Are you getting this? And that
Yes.
person can be anyone, can be anything from the whole Matra Medica. Right now, we have more than 10,000 medicines in homeopathic Matra Medica. So that person can be anyone, can be anything among this whole of the Matra Medica. So this is the secret of prescribing. If you will try to prescribe medicines for nerve damage, then you can miss the real cure because this is not our principle. Our principle is holism and individualization. We do not treat locally. We do not prescribe on local symptoms. We do not treat local damages. But we want to correct that PNA axis, the whole, not the part. And when we try to find medicine for that whole, how individual that person is, on the basis of that, then that medicine will do wonder. So there are no specifics in homeopathy. There is no specific medicine or group of medicine for GBS or nerve damage or something like that. We need to understand that person completely, wholly, and individually. Then only we can produce good results. So this is the secret. Good?
Yes.
Any further questions, Dr. Priyanka?
No, ma'am.
Okay. We have some questions in comment section, sir. Shall
Yes,
I ask them?
yes. Why not?
Mm, Bharat Singh Gohil has asked, does it has relevance with recent viral infection or recent vaccinations?
Yeah, there are some evidence that this autoimmunity is triggered after viral infection. It is triggered after vaccinations. So, but we don't have direct evidence. I cannot see with evidence that this particular vaccine has caused this epidemic. But we know for sure that vaccinations or viral infections, bacterial infections even, that may trigger autoimmunity. So you can think, you can mm, say it with logic, but unfortunately we have not experimented that. So we don't have any evidence to prove this scientifically.
Again, he has asked, homeopathy treatment solely treats the disease or it's a compensatory treatment,
It
complementary
depends.
treatment.
It
Sorry.
depends. It depends, Bharat. It depends upon in which condition patient is. As I have told that some patient may get very serious. They may need life support. And at that time, you need to supply life support, oxygen or ventilator. Even some patient may need ventilator because of respiratory failure. So in that case, you need to provide these uh, life supports. But what my point is, if you prescribe homeopathy medicine along with this life support, recovery will be very fast. It will be wholesome recovery. And if patient is at initial stage or in convalescent stage, in recovery stage, at that time also if you prescribe homeopathy medicine, then patient will get cured rapidly, gently, and permanently. This is what we need. I just gave one example now that patient has all the treatment, but still symptoms were present. What to do now? Should we just for 1, 2, 3? No, we cannot wait. Damage will be permanent. And we prescribed homeopathy, patient recovered from that condition within 48 hours. So this is what we can uh, provide to the patient. I don't say that you just depend upon homeopathy completely, but you should be physician first. You know? Homeopathic doctor must be physician first. This is the first aphorism, first word of the whole organon, the physician. And Dr. Haniman has not used word the homeopath. So what do we mean by the physician? You should not be homeopath. You must be a good physician. And the physician mean whatever required at that particular time, you must use that along with homeopathy. Because patient comes first, not the homeopathy, not the allopathy, not the Ayurveda, but patient comes first. His life comes first. And to treat, to heal, and to cure, this must be our mission. This must be our whole motto of the treatment. So if patient is getting benefited with any treatment, with any XYZ thing, And this XYZ thing is based on science principles without any side effects, without any harm, then we must use that. And this is what homeopathy offers. Homeopathy is a scientific, homeopathy is without side effect, homeopathy has no harm on any patient, but homeopathy cures holistically, dramatically, magically. This is the reason why we should use homeopathy. I hope it is good for you, Dr. Bharat, right?
Yeah. Yes. Sir, lastly, I want to add one question. Mm, Does any lifestyle changes or diet changes help in recovery of GBS?
Yes, yes, definitely. So there is basically nerve damage, right? So, and there is profound weakness and tingling, numbness, patient cannot walk. You can imagine this condition. So rest is very important. Don't overexert or exert that patient. Provide good supplement to that patient so that patient will feel energetic and all. But this good food should not be very spicy or any stimulants like coffee, caffeine. No, but gentle, mild food which will provide energy to the patient, nutrition to the patient, especially B complex, vitamin D, like these things. And patient get very frustrated, very demotivated, so and stressed out because he is now paralyzed. Na? That patient was walking before 1 to 3 days, and he is now paralyzed. So he is very depressed. So and that depression, that stress, also called muscle contraction, muscle tightness. So we need relaxation and yoga, meditation, deep breathing. This provide relaxation. These are the relaxation techniques. So we must use these relaxation techniques. And when we will try everything, then patient will get out of this condition very effectively, promptly. So we must provide good food, nutritious diet, rest, and some physiotherapy also, and relaxation techniques. This all will help.
Great. So thank you, sir. Thank you both, Dr. Priyanka. We had a wonderful session today. Hope we are able to spread awareness and help people to reach us much faster. So thank you. Good night.
Okay, bye bye everyone. Bye bye, Dr. Priyanka.
Thank you so much, sir.